Cancer Care Western New South Wales is a charity registered in 2007 with the aim of developing and improving support services for cancer patients in Central and Western New South Wales. After successfully lobbying for radiotherapy services in Orange and implementing the completion of Western Care Lodge, Cancer Care Western New South Wales is seeking community funding to develop cancer clinical drug trials at Central West Cancer Services based at Orange Hospital.
Behind me you'll see Western Care Lodge, which our association has built over the last few years with the kind assistance of the people of the Central West and the Western area. This facility allows people travelling from your communities to come and stay here while they access radiotherapy services here in Orange. It has saved them the many hours of travel to and from public hospitals in Sydney to have that treatment and the disruption that causes. However, many patients from the Western area require access to new and promising drugs that aren't currently available on the PBS system. At the moment, the only way they can get access to those drugs for enhancement or prolonging of life is to go to one of the public hospitals in Sydney, where they run drug trials developing and testing those drugs. We now have the opportunity of extending that service to country patients through the Orange Cancer Centre here at our hospital. We need your help in raising money to provide that service. We are lucky to have a team of dedicated oncologists and a haematologist here in Orange who are keen to offer that service to country patients. That is, access to these new and very promising life-enhancing drugs. They need extra staff to provide that service. Those staff will cost, over a period of 2 years, approximately $300,000, and our association has undertaken to provide those funds to enable the unit to start operating and establish those drug trials. There are already bowel cancer drug trials being run here in Orange, but we want to widen the field, make it available to more people, different drugs, and at the moment the only way for those patients is to go to Sydney, often on a weekly basis, creating huge expense and terrible stress at their worst possible time. You'll now hear from Dr. Rob Zielinski, one of our dedicated team of oncologists, who will tell you about the importance of these drug trials. And you will also hear from some of his patients about what a difference access to these new and promising drugs has made to their lives. We need your help. Please listen carefully, and this is a very worthwhile project of our association. Thank you.
Clinical trials are really the final step along the pathway that drugs follow from the lab that make their way into clinical practice and ultimately patients. In order to get a drug into a new patient, we need thousands of willing volunteers, and clinical trials are the mechanism to enrol those volunteers into trials that advance science. Every single advance in oncology has relied on patients volunteering themselves to clinical trials. It's how we run our business, and therefore they really are the lifeblood of any oncology service. Obviously, clinical trials allow new drugs to get into patients earlier than the PBS system is going to provide those drugs to everyday individuals. Country patients have been the poor cousins in lots of ways, but clinical trials is another example of health disparities. Every week in clinic, I talk to patients about clinical trials that are being run in Sydney, testing novel drugs that are really making a huge difference in patients' lives. Every week, sadly, a lot of my patients cite the barriers to travelling to Sydney as just too great. So these guys are missing out on perhaps novel drugs that will meaningfully extend their life and alleviate suffering. Without a good, robust thriving clinical trial centre in our district, patients move on to palliative care perhaps sooner than they would if they were living in the city. And this really needs to be readdressed, and that's what this whole thing's all about, trying to get a good, thriving clinical trial centre in our district so country patients no longer have to miss out. The funding is needed because the government provides very limited support to clinical trials, despite a policy that states that 10% of all cancer patients should be on a clinical trial at some point in their treatment. Therefore, with limited funding from the government, we really need to look elsewhere. Unlike chemotherapy and radiotherapy, where there's a lot of infrastructure costs, the cost of clinical trials is all about people. They're our lifeblood, and we need some money now to build up the clinical trials centre so that's viable and self-sustaining in the future. So we need the funding now, otherwise it'll just take too long to set up a good, robust clinical trial centre to allow patients to access these novel therapies now, rather than waiting 5 or 6 years for the PBS to fund it.
Originally I was going to Sydney for 3 days, so I'd have to go down there. It's 2 nights in the motel. This drug has wiped it out. And when I heard that news, you know, I just had to tell everybody, and you know, I just wish other people could go through this. Don't want to get them to get sick, but if they can get help like I've had, it would be tremendous.
I was given a clinical diagnosis which 4 different oncologists told me that I'd have 12 to 18 months to live. 18 months later I'm 87% reduced on that, and the trial has had a massive effect on that. The lymph nodes have returned to normal, there's minimal scarring on the lungs, and there's nothing at all in the bronchiole. So it's all been pretty much fully cleared through. So with the alternative, which I was told to go away and make your power of attorneys and all that sort of thing, it was quite a kick in the teeth, as you can understand. But to be offered the clinical trial and to do the clinical trial and to get the results of what we've got, my wife actually broke down and cried when she got the results, and I got a bit teary-eyed looking at her getting teary-eyed. So it was quite an amazing bit of news to come through, that's for sure. It was the best bit of news we'd had since we first got told of the alternatives. So it was good, yeah. Well, if you could do it locally, which would be good, you'd only have a 1-hour trip either way maximum. You could be home with your wife each evening. You wouldn't have to nowhere near the fatigue, the stress, the financial burden. And you'd have more support from your community as well, because they don't even realise, at the time, they didn't even realise what a clinical trial was. They didn't understand the concept of what it's like to pack your car up every 2 weeks, what it's like to try to throw clothes in a car, what it's like to go down there. You've got to be there by 8 o'clock in the morning, where the reality is, if you had it closer, you could come here within the hour, do your thing. You'd probably have maybe half a day and you'd be back home that same afternoon with nowhere near the same sort of fatigues, nowhere near the same sort of burdens, and you wouldn't have the same stress factors on you. It would be much, much better.
We need your support and donations to assist cancer patients in your community to access this essential treatment option. Donations may be forwarded to Cancer Care Western New South Wales at Post Office Box 2800 Orange 2800, marked Attention Clinical Trials. For other details, phone Jan Savage on 6362 7665. Cancer Care Western New South Wales website www.ccwest.org.au.